Hey guys, I'm just going to show you some exercises that I've been doing to try and maintain some bit of function on my injured leg. So I am 3 weeks as of yesterday, post full rupture, decided to go non-operative. I started back in the gym after like 12 days just doing upper body, no lower body. I'm working my good leg pretty aggressively. So to whatever level of training or movement you had available before, you're going to try and do that on your working leg as much as possible. I have some easier, less involved exercises that I've been working on that are available somewhere. This is a bit more advanced. So I would say this one, if you are already doing things like deadlifts, if you understood that position before you got your injury, I would say this would be a nice one to add in. So again, I'm going to use this support, right? And you could use 2 crutches, 2 poles, however much support you need, you should use backs of chairs, everything, whatever's going to make you feel comfortable. And what I'm trying to do here is bring my hip into flexion, right? And then I drive through and I bring my hip into extension. So I'm trying to really work the function of the hip, even though I can't load it, right? So right now there's absolutely nothing in my foot. I've got no tension in my calf, which is nice, but I'm really feeling the glute back here. What I'm trying to do is open up that hip. So when our foot is in the boot like this, and even as it's going to be coming out of the foot, out of the boot, we're not going to get a lot of hip extension, because we won't be able to dorsiflex our ankle, so we won't be able to push that foot back. So to be able to get that hip extension, I'm getting it up here. I'm really driving down, I'm really squeezing my glute. So I'm feeling my butt work super, super hard. So this is my first week doing these exercises. I'm gonna stick with these for another week or 2. Then I might add some weight to it. Not weight onto the boot, but maybe I'll hold a light weight to the side or something like that. You play around with it. Again, just remember what we're trying to do. We're trying to maintain as much function as possible. All right. So another one I'm going to work on now. Again, I'm going to keep the bench here. Now this again might be a little bit more advanced. So everything's about your own comfort level. But I'm putting no weight on the boot. There's nothing there. I'm lifting over the bench and back. Okay, and this is hard. Like, I'm working to do this. I'm working hard. But again, what can I still use without putting any pressure on the calf? I can use my hip flexors, my hip abductors, my hip adductors, my internal rotation, my external rotation. And we're going to go for as many reps as you can. I wouldn't worry too much about like a set number of reps. Instead, I would work until you can't work anymore, or maybe until you feel nervous with it, okay? Now, I'm not a physical therapist, so don't just go throwing these in without getting an all clear. But also, if you're a little bit more athletic and you're looking for some inspiration on what we can be doing, these are some good ideas.